My name is Lauren Brown. I'm the chair of the IFS. And today we have an incredible talk sponsored by Dutch Test, also known as Precision Analytic. And our speaker is Dr. Carrie Jones, naturopathic physician. And we're going to talk about low cortisol and autoimmune diseases. Before I do that, I want to spend a few minutes just doing some general housekeeping so you can benefit from this lecture and other things that we have happening at the IFS. So first, going to healthyseminars.com, just want to let you know if you want to know about these kind of talks and other talks that are coming up, if you go to the resource page, it takes you to the Community Unity Immunity page. This is our resource page, and this was created to keep us connected so we can learn. And back when we were practicing physical isolation, but not social isolation. And we've continued this. So the Community Unity Immunity page, and if you scroll down, you'll see our calendar. And today we have our talk, Is Your Low Morning Cortisol Increasing Your Autoimmune Risk? And so this is the resource page, and we are going to be adding a lot of lectures throughout July and August, so do come back. You see we have a few more for June. Please know we have a special IFS one happening June 30th. I have not posted it yet, but it's research, like it's not even in press yet, but it's going to be, where they're showing preconception care improved IUI rates and IVF success rates. So I have the doctor giving their oral presentation on the 30th. They're going to share what they're allowed to do, what they're allowed to share, but stay tuned. My point of telling you this is come back to the resource page. Now, today's talk is sponsored by Precision Analytical. This is Dutch Test, and our speaker is Carrie Jones, naturopathic physician. If you go, because the recordings are here, and if you want to get the handouts, this is really important. On the resource page, if you want to get to the IFS website, click on IFS 2021. And then when you go to the sponsor section on the IFS website, anybody, whether you are part of the IFS or not, anybody can go to the sponsor pages and see the educational material they've created. Because for IFS 2021, we asked our sponsors, like Dutch Test, to be part of the IFS. You need to participate in creating educational material. So yes, we want to know about your products and services, and yes, we love your discounts. However, we wanted you to participate, and they did. So if you go to their sponsor page and you go to the Dutch Test page, and you scroll down, you're going to see a few talks by Dr. Carrie Jones. If you want handouts to any of these talks, please contact the Dutch Test directly. And there's that green link here where you can do this to get more information. So here's the talk we're about to listen to by Carrie Jones. If you want to listen to it again, it's on the sponsor page. We will add the recording to this live Q&A shortly. There's also another talk about low progesterone. Is it a problem with ovulation? Is it a problem with the ovulation, or is it with the corpus luteum? And she's going to talk about how this impacts fertility and other gynecological issues. That's available online. And then last year, Carrie did one for IFS 2020 that we put up. It's a longer talk, but we talked about sex drive and hormones and how do you make a baby when you're not in the mood. Excellent lecture. All of these lectures are on the sponsor page for Dutch Test. So if you go to their page, you can watch any of these recordings at your leisure until August 31st. And if you want the handouts, which I highly recommend, just go and contact Dutch Test for that, for their handouts. Also, if you are part of the IFS, if you go to the forums and you go to the special offers, I do want to let you know that the Dutch group has put together special offers. So if you go to the forums under special offers, you'll see the little icon here, and they have a special deal for IFS participants. So you can ask them about that as well. If you're part of the IFS, click on this link and it will give you all of that information. So our topic today is your low morning cortisol increasing your autoimmune risk? And our speaker today is Dr. Carrie Jones. She used to be an adjunct faculty for many years at UNMM, teaching gynecology and advanced endocrinology and fertility. And she's been the medical director for large integrated clinics in Portland. And she's also the medical director for Precision Analytic Dutch Test. And so we're really excited to have her back. Carrie's been speaking on healthy seminars in the past, so she has lectures on healthy seminars, on detox pathways. They're excellent. We've had her as part of our Community Unity Immunity lecture series before. Her lectures are amazing. If you can see this lecture here, fantastic. The Three Best Friends, reviewing the relationship between the ovarian, theca, granulosa, and lutein cells. Brilliant lecture, available for those that are part of the IFS. So if you have not registered for the IFS, you can do so now. We've opened registration up for the rest of June of 2021 because we've extended access until August 31st, 2021. So if you want to still join the IFS, you are welcome to do so. Just go to the IFS website and click on register. And now you have access to Carrie's CEU course, plus the other 16 lectures that are available and approved, up to 36 hours of content. A reminder to the IFS people here, when you go to your dashboard, all your courses show up there. And then on the left-hand side, we have pop-up lectures. Remember, we've been having pop-up lectures. We have one coming up for the IFS people on vaccine related to fertility and pregnancy. We have an acupuncturist and a reproductive endocrinologist talking about how to answer questions, safety, the research. And we'll have a panel of other experts to answer your Q&A about vaccines for COVID, the COVID and the vaccine. That's a pop-up lecture happening in June. We've had several already that are available here. We have their sponsor lectures, and then we have public educational videos for you guys. These are videos that are made by experts, that we had made by experts. They're short, and they're meant to inspire the public through education so they seek you out for integrative care. And that's also available to all those that are part of the IFS. I do want to remind you that this lecture by Dr. Carrie Jones and sponsored by Dutch Test is for educational purposes only. It is not intended to be medical advice, so should not be perceived as medical advice. If you have a health condition, please do seek out a healthcare provider. This is for educational purposes only. All right, let's bring up Carrie's video lecture. Carrie's live with us. We're going to do her live replay of her lecture. Post your questions in the chat. We are going to collect those questions. And then at the end of this 29-minute lecture, Carrie's going to respond in a live Q&A with you guys. All right, let's watch and enjoy.
Hello, my name is Dr. Carrie Jones, Medical Director for Precision Analytical, creators of the Dutch Test. This webinar is going to be about cortisol. Is your low morning cortisol increasing your autoimmune risk? Let's dive in. Our objectives for this are to really understand autoimmune facts, because autoimmunity is on the rise, and to understand specifically how cortisol plays a role in autoimmunity. And we're going to talk about a case at the end to really help emphasize this. So, autoimmune facts. Autoimmunity is affecting about 8% of the population. And unfortunately, 78% of those are women. A big autoimmune organization, the AARDA, states that there are over 100 autoimmune diseases, whereas the NIH, the National Institutes for Health, says there are over 80. Either way, 80 or 100 plus, it's a lot of autoimmune, and many more are probably to be discovered. Treating autoimmunity is a multi-billion-dollar healthcare industry each and every year. And you know this. You have a lot of autoimmunity that walks through your clinic, talks to you in telemedicine. You might even be dealing with autoimmunity yourself. And according to the NIH specifically, the Intramural Research Program of the National Institute of Environmental Health Sciences, they say autoimmunity is on the rise. And we know that as practitioners. When it comes to autoimmune disease, autoimmunity is either Th1, which is T-cell mediated, which is what we're going to talk about with cortisol, or Th2, which is B-cell mediated. While I've said earlier that with autoimmunity, we're going to specifically focus on cortisol, please know that there are a lot that risk factors that go into autoimmunity. Everything from other hormones to environmental to genetics, but we are just going to focus on cortisol today. So let's talk about cortisol. Cortisol signaling starts in the brain. The hypothalamus releases CRH, corticotrophin releasing hormone, which then goes to the pituitary to release ACTH. And then ACTH goes down to the adrenal glands and tells the adrenal glands, specifically the mitochondria of the zona fasciculata, to start producing cortisol. Now, if you need a little graphical, here we go. We have our HPA axis, the hypothalamic pituitary adrenal axis. So the brain releases CRH, tells the pituitary to release ACTH, and goes down to the adrenals. Now, you will see on here norepinephrine and epinephrine. ACTH does not release norepinephrine and epinephrine, but it does help in its production. When we zoom way in on the adrenal gland, you will see the adrenal cortex, which is the biggest part. And in the adrenal cortex, that's where we get the 3 layers. The zona glomerulosa, which is aldosterone, the fasciculata, which is cortisol, which is what we're going to focus on, and the reticularis, where you get your DHEA and DHEAS. And of course, we can't forget about the medulla, which is where we get our catecholamines, norepinephrine and epinephrine. But going back to our mitochondria, going back to the zona fasciculata, it's important to know that your cortisol production starts and ends in the mitochondria. Therefore, mitochondrial health is really pretty critical when it comes to addressing the adrenals and cortisol production. So cholesterol gets pulled in and it becomes pregnenolone. Pregnenolone then leaves, goes out to the endoplasmic reticulum, becomes 11-deoxycortisol, which comes back inside to the mitochondria, finishes out as cortisol, and then goes out into circulation. So if you're hearing a lot lately about mitochondrial health and cortisol, this is why, because cortisol production starts and ends right here. When it comes to cortisol release, of course, we know it releases in a circadian rhythm, meaning it's high in the morning and it's low at night. I always say that cortisol follows the sun and melatonin follows the moon. Specifically in the morning, though, it's known as the cortisol awakening response, or the CAR. And it's the health of your CAR on waking that gives us a lot of information. Before we dive into that, though, let's talk about testing, because not just any test will pick up the cortisol awakening response or really understand that diurnal rhythm that cortisol has throughout the day. Testing cortisol is really important. This is where Dutch comes into play. So Dutch looks at a lot of hormones, but again, we're primarily going to focus on cortisol. When you have options for cortisol, you can look at serum, you can look at saliva, and you can look at the dried urine test for comprehensive hormones, which is known as Dutch. Now, if we start in the center at serum, everyone's familiar with the blood draw. We know that we can use blood draws to test all sorts of hormones, but when we get a blood draw to look at cortisol, please know that's a total cortisol of what's in the blood at that moment, meaning it's a combination number of cortisol bound up to its binding globulins and what's free and active. So if you get a blood draw for cortisol in the morning and it's 10, you have no idea if that number 10 is 9 cortisols bound up to binding globulins and 1 free cortisol, or 9 free cortisols and 1 bound up to a binding globulin. And obviously it's the free cortisol that does all the heavy lifting. It's the free cortisol that binds to receptors and turns them on, does the stuff, right? That led to saliva, because saliva was easy to collect. You could do it throughout the day. That gave you your circadian rhythm. And salivary cortisol is free cortisol. And again, it's the free cortisol that does all the heavy lifting, binds to receptors and turns them on. Unfortunately, though, with saliva, you can't get other information such as metabolized cortisol. And not a lot of saliva companies are checking the inactive form, which is known as cortisone. So that led to the creation of Dutch, dried urine test for comprehensive hormones, where you can use the urinary aspect to get all your hormones, to get cool information like cortisone, metabolized cortisol, and get your rhythm throughout the day. And then you can combine it with saliva to specifically focus in on that cortisol awakening response. And that with the Dutch Plus, or that for Dutch is known as the Dutch Plus. So let's walk through quickly what it looks like when you're going to do your collection. First of all, when I say dried urine, not a lot of people know what that means. This is our collection device. This is what it looks like. So when you do a Dutch Complete or a Dutch Plus, you will urinate on these pieces of filter paper throughout the day. You'll do it first thing in the morning, a couple hours later, around dinner, before bed, and if you happen to have insomnia, you can collect it in the middle of the night when you wake up. Then along came the addition of saliva to add to it the cortisol awakening response. Now, you can choose from a saliva swab or a saliva tube, depending on the company. The problem with saliva tubes is that you have to passively drool or spit into the tube, which can take a lot of time. And when we're looking at the cortisol awakening response, time is of the essence, which I'll show you in just a second why, especially when it relates to figuring out autoimmune disease. Some companies do suggest that you rinse your mouth out with water prior to collection, and then you have to wait to resalivate your mouth before you can drool back into a tube. And unfortunately, that can cause too much time to go by, and you miss the true cortisol awakening response. Then we have saliva swabs. Saliva swabs are exactly what you think. They're these like little cotton swabs that you pop into your mouth, get wet, and then put back into the tube. Because they're very rapid and because it's something you can do very quickly and easily, you get a truer CAR response. And in fact, it's so much better that this is what research uses. They use these Salivette swabs. Therefore, at Dutch, we use the Salivette swabs as well. We don't encourage or use or want you to passively drool into a tube. We want you to be able to just pop the cotton into your mouth, get it wet, stick it back to the tube because time is of the essence with a CAR. So the Dutch Plus is our combination test that does all of the urine markers in combination with the cortisol awakening response and cortisol through the rest of the day. So it's 4 dried urine samples so that you get things like your estrogen metabolism, your androgens, your androgen metabolism, your progesterone, your organic acids, all of that comes in this. Plus, we add in the Salivette tubes or swabs so that you can collect your cortisol awakening response in the morning. So the collection is very specific. It's done in the morning, 30 minutes later, 30 minutes after that, around dinner and before bed. Plus, if you have insomnia, like I said, we do give the option that you can collect in the middle of the night, and then we can see what your cortisol is doing when you wake up at 2 in the morning or 3 in the morning. So by getting the urine samples in combination with the Salivette swabs, we get a really great picture of everything that's going on. With the cortisol awakening response, I did want to draw it out on how you collect and why this is important. The cortisol awakening response is really quick first thing in the morning. It is a natural response to when you open up your eyes and feel awake, or your alarm goes off, or you get awoken, I should say. So you collect as soon as your eyes open up. Pop the little Salivette swab in your mouth, get it wet, stick it back in the tube. 30 minutes later, you're going to do it again. 30 minutes after that, you're going to do it again. So it's waking, 30-30. It's very quick. The 4th collection is around dinner. The 5th collection's at bed. And as I said, you can collect if you have insomnia. Why is this important? Why do we give you urine and saliva? Because we want to give you as many data points as possible. If you're working with somebody who has autoimmune, hormones are often always involved. So while the cortisol portion of it is very important, you still want to see what their estrogen is doing. You still want to see what their estrogen metabolism is doing. You still want to see what things like melatonin is doing, their testosterone, their B12 marker, methylmalonate, things like that. So by having as many data points as possible for your patient, you can really help to address what's going on with their autoimmune symptoms and the progression of their autoimmune disease. When you are assessing stress, this is the typical 4 points that you're probably used to. So they collect on waking, they collect a few hours later, they collect, in the afternoon around dinner, and they collect before bed. But as I said, the cortisol awakening response is different because it influences so many things when you kick off the day first thing in the morning. We really want to focus in, instead of a broad, general cortisol look, we want to hyper-focus in, because if you struggle with your cortisol awakening response, you're going to struggle with alertness. You're going to struggle with energy levels in the morning. You're going to struggle with stress response or your resilience, your level of feeling stressed out, blood sugar management. Remember, cortisol's main job is to deal with glucose. We talk about stress all the time, and we talk about energy as it relates to cortisol. But really, cortisol is a glucocorticosteroid. Gluco, because glucose is its primary job. So if your car is not very functional in the morning, you could struggle with blood sugar issues. Autoimmune development, which we're going to get into in just a second. Inflammation regulation. How many of your clients say to you, I wake up in pain? Wow, when I wake up in the morning, I'm so stiff. Everything hurts. Your car can play a big role in this. Infection regulation. We know cortisol is anti-inflammatory to a point. memory and recall, especially things you have learned today and recalling it the next day. If you were listening to this and the next day you're thinking, what was it that Dr. Carrie said? You might have car issues. And of course, cancer outcomes. We know the slope of the cortisol curve can, depending what your slope is, can help or hurt cancer outcomes, especially when it comes to breast cancer. And there is even some research to show with prostate cancer. So we'd like to know what our cortisol curve is doing in our cancer patients. So how does the CAR work? Where does it come from? What in the body triggers it? So as you are getting closer to waking up, your pituitary is signaling ACTH production. And ACTH is going down to the adrenal gland and saying, hey, let's get up. Like now, can we get up now? And the adrenal glands have a blunting on them, on the receptors. And they're like, not yet, not yet, not yet. As soon as you open your eyes and you've registered that you're awake and light comes in, the blunting comes off, ACTH combined, and your cortisol shoots up. It's a natural increase in cortisol in the morning. This is why it's the awakening response, the CAR. That rise is very quick. Within about 30 to 45 minutes, it shoots up. Not hours later, not by lunchtime, but just 30 to 45 minutes later. This is why your timing of the collection of cortisol, if this is the component you are looking to test, is so important. Because if you miss the 30 to 45 minute mark and then the 60-minute mark or the waking mark, anywhere in there, you're going to miss the accuracy of what's really going on with your cortisol awakening response. Once you hit the peak of cortisol, it gradually starts to decline if it's normal. Not all people do that, and we have to help them. So the real question is, can you make a switch? Can you make the switch from I am conscious to I am alert? The real question that I ask every single person is, how long does it take you to feel alert in the morning? It's our cheater question to what's going on with your car. If you say it takes you like 2 hours and 2 cups of coffee to get going, I already know that you have a cortisol awakening response problem. Your car is likely flatlined or it's not spiking like it should because you need that oomph in the morning to get you going. Now, on the flip side, if you say now, oh my gosh, I wake up in anxiety, I wake up with panic, I wake up 0 to 100 very quickly, then your cortisol awakening response is probably overshooting, overzealous, and we needed to help with calming it down and figuring out what the triggers are. What's triggering you to have such a response first thing in the morning? So ask the question, how long does it take you to feel alert and ready to go in the morning? It should only take you about 30 to 45 minutes. This is what the CAR looks like zoomed in on the cortisol. Now, you might think to yourself that it looks like a normal cortisol curve on other tests, but it's a zoomed in look. So this is, again, waking 30-30. This isn't waking in lunchtime. This isn't waking in 2 hours later. This isn't, just doing it at waking or randomly throughout the day. It's waking 30-30. So we zoom right in. When your patients say to you in the morning, I wake up with, that's when you really want to consider this test. In the morning, I wake up with autoimmune symptoms. In the morning, I wake up with panic and anxiety. In the morning, I wake up with pain. In the morning, I can't wake up. That's when you consider this test because we need to see what's going on right here on waking in the morning. So let's focus in on autoimmune. With autoimmune, I'm going to go back for a second because we're going to be looking at the thymus gland. Now, not thyroid, but thymus. That's right here behind your breastplate here. So with the thymus gland, your thymus gland is super cool and super smart and really important to your immune system. So there's a study. Glucocorticoids are strong inducers of apoptosis in thymocytes. What does that even mean? Well, let's pretend you're a T cell. You're a T cell and you're a T cell in your thymus gland right now. So when you are first a T cell, you are what's called an immature double negative. So you're not a CD4 and you're not a CD8. You're kind of in this gray area hanging out. And so what you do as you mature, as you go through, T cell school, is that you then differentiate to become a CD4, CD8. But you can't be both. You can only be one. So you go from immature double negative then you differentiate into a double positive, and now you have to pick one. You've got to figure out which one you are. Unfortunately, though, we know apoptosis occurs all over the body, and most of your T cells don't even make it out of T cell school. They die. They go through apoptosis. The ones that do survive have to go through something called central tolerance. Now, central tolerance is where the thymus gland basically has every single piece of tissue in your whole body, and it runs those T cells across all of these pieces of tissue in your body to see if they react. They want to know, the thymus gland wants to know, do you react to any of your own self peptides? As an easy example, let's pick thyroid, right? So if you're going along, if you autoimmune react to thyroglobulin, then that's going to be a problem. And the T cells like, you fail. You basically fail because the thymus is like, you can't react to thyroglobulin. You can't react to thyroid. This is a big problem. I can't release autoimmune T cells out of T cell school. So what happens is if you pass, you become a single positive, which is a CD4 plus or a CD8. If you don't pass, if you have found that you are positive to a tissue such as thyroglobulin, the enzyme, then you have to be killed. I'm sorry, you have to go. So you fail out of T cell school and you have to undergo apoptosis. Now, how to trigger that apoptosis is the rise in cortisol in the morning. It's one of the big signals to the thymus gland to say, hey, all those little T cells that you've pulled aside that have failed, that are autoimmune, then cortisol spikes and the thymus gland activates apoptosis and they die. So the take-home message is if you have a low or a flat cortisol awakening response, if your cortisol is low in the morning, then those failed cells aren't killed. And as we know, cells are sneaky and they will just float themselves right out of the thymus gland and go into circulation. This means if you have reacted to thyroid and you now float yourself out of the thymus gland, you can now react to thyroid in the body. You could induce autoimmune Hashimoto's. You could worsen symptoms of Hashimoto's that you thought you had under control. It can go either way. So this is part of the reason with autoimmune that understanding your morning cortisol rise is so important. I gave thyroid as the example. It could be any of the tissues, anywhere in the joints, in the muscles, in the brain, anywhere. And so that's why it's important to know what cortisol is doing. So speaking of thyroid, let's look at a thyroid case. This is a woman in her 40s. These are her results. She had fatigue, especially in the morning. She's one of those people who said, in the morning, I cannot wake up. She required 2 to 4 cups of coffee to feel alert and ready. She has sleep apnea, but she doesn't use her sleep machine. She finds it, not sexy, is what she said. She uses a steroid allergy nasal spray in the morning sometimes, and she has Hashimoto's antibodies that have greatly increased recently, and she definitely feels more, quote, thyroid symptoms. So when we're looking at her cortisol awakening response, if we zoom in, remember I said this is supposed to be, you go up to a point and then you come back down. She doesn't go up to a point, she flatlines. So she wakes up and then basically even kind of goes down a little before coming up a little and then going down for the rest of the day. So it's no wonder she needs 2 to 4 cups of coffee. She never gets that oomph in the morning. And it's no wonder she's feeling more hypothyroid symptoms, especially in the morning, or more autoimmune. So what can be happening? Well, we know that there's a negative feedback loop to the brain, which is with HPA downregulation. So it's possible she had high cortisol months ago, and now, because of the feedback loop, it's starting to decrease her cortisol. It could be poor HPA communication. She does, have sleep apnea, so it's possible her CRH and ACTH are not coming out of the brain like she should. She's not properly oxygenating the brain. It could be mitochondrial dysfunction. Low overall cortisol production occurs when the mitochondria aren't doing that well. Excessive amounts of psychological burnout, another big suppressor of the cortisol awakening response. Sleep deprivation in general. So I mentioned with sleep apnea that can affect HPA communication and oxygenation to the brain, but just sleep deprivation in general, because of her sleep apnea, because of snoring and disordered breathing, that can absolutely suppress what's happening with the cortisol awakening response. Now, she doesn't have this, but just as an aside, traumatic brain injury or any damage to the hypothalamus or the pituitary can also affect someone's cortisol awakening response. So with her, it's important to know that the hippocampus affects or controls the cortisol awakening response. And sleep apnea can really, really, really affect the hippocampus. Other things can too. Traumatic brain injury is an example, brain infection, brain inflammation, but sleep apnea I really want to point out. Chronic pain, inflammation, infection, in general, anywhere in the body can downregulate the HPA axis over time. That feedback loop kicks in. PTSD, that's not acute, so post-traumatic stress disorder, doesn't apply to her, but as a general FYI, these are other things that can help affect it. Seasonal affective disorder, so for those of us who live in not sunny areas, in fact, if it's gray and raining or gray and snowing, or gray and miserable for a lot of the year, then we get seasonal affective disorder and it can lower the cortisol awakening response. Long exposure to fluorescent lights can be suppressive, as can suppressive medications such as opioids or steroids. And those steroids can be just like the steroid nasal spray that she's using. It can be like in joint injections. It can be the oral tablets. It could be inhalers. Anything that's steroidal can over time definitely suppress the HPA axis. So there's a lot that we have to look into as to what's suppressing somebody's cortisol awakening response. So when we look at her, when we go back with her worse fatigue because of the low CAR, she doesn't feel alert or switched on in the morning. She has increased risk of worsening her autoimmunity. She already has Hashimoto's and now she's feeling worse. And possible increase in future things. I've talked about blood sugar, inflammation, recall, memory issues, especially as she moves out of her 40s into menopausal years. And we already know brain fog can be a big issue there. And hormones are shifting there, and we know hormones have a big interplay with autoimmune. Understanding and improving her CAR right away is only going to help her case. So support options for her, focus on the basics, self-care, sleep quality, sleep hygiene, circadian rhythm optimization, meaning getting light in the morning, darkness at night, blood sugar regulation starting now, especially as her cortisol's not that great, and cortisol and glucose have that great interaction. Movement, hydration, community, these are the basics that just help with cortisol, helps with the HPA axis response. Reminder to use her sleep mask or to go back to her sleep doctor and get further evaluation if she feels like her sleep mask is not working. Address why she needs a steroid allergy nasal spray, because as I just said, steroids can be quite suppressive, especially over time to the HPA axis. And supplements to consider just to help give her the oomph, help to bolster her. So brain support, maybe something like Bacopa, adrenal and mitochondrial support. And when we work with the circadian rhythm and we work with the cortisol awakening response, we tend to give supplements for them on waking. Remember, she sort of goes down or flatlines. So we've got about 30 minutes where we want to make an impact. And so I'm going to suggest her brain support, her mitochondrial support to be given pretty much on waking if she can. I know not everybody can, especially with thyroid medication. Thyroid and a lot of supplements can interact with each other, but some people do take their thyroid at night. Some people set their alarm and take their thyroid really early in the morning and go back to sleep. So kind of depends on the case. But in general, if you can have somebody take their supplements on waking, that can really help impact their cortisol awakening response. And then, of course, sleep support at bed while she is working with her practitioner about her sleep apnea. So the purpose of this webinar, there's a whole lot more that goes into the cortisol awakening response. There's a whole lot more that goes into treatment. But I want you to understand the importance of cortisol and what it does, not only with, of course, everything else, but autoimmunity. And when you look at the Dutch Plus with your autoimmune patients, what's great is that we at Precision Analytical have a wide variety of resources to help you, one, interpret the test, and then two, understand what can you do with it? How can you support a healthy cortisol awakening response? And in addition, take all those hormones into play with your patient in adjusting for their long-term health outcome, reducing autoimmune, improving symptoms, improving energy and sleep, improving resilience, because that is what's really important. So in summary, autoimmunity is prevalent and unfortunately on the rise. And as we've talked about, the CAR plays a role in autoimmunity. It really helps that thymus gland pull aside and kill off any T cells that have failed central tolerance. By using the Dutch Plus, you get the Salivette swabs, so you don't have to freely drool into a tube. You can just suck on a cotton swab and then put it back into the tube. Very convenient. We know that we always want to address the cause, of course, but in the process of addressing the cause, we will use cortisol signaling support so that we get the brain health, and we will use mitochondrial support so we get the production part. So from start to finish, you're really addressing your cortisol. And last but not least, my absolute favorite, utilize light and dark therapy to your advantage. It sets and corrects the rhythm for your daily clock, right? The clock that sets how you get up in the morning and how you go to bed at night. So use full spectrum light in the morning and make sure you're sleeping in complete darkness, winding down before bed. If you are new to the Dutch test, if you are new to Precision Analytical, we do have a special offer for you. You can sign up to be a provider today. And then when you do, you will get the offer to receive 50% off up to 5 testing kits. That does include the Dutch Plus, which we have been talking about. You can then take that information and get clinical consultation with one of our Dutch experts. And we do put you in our system so that when we have patients who call and say, I ran a Dutch test on my own and I'm looking for help, who would you refer me to? We can have you in our system and be able to send them to your clinic. If you're interested in getting started, definitely give us a call or feel free to email our sales@dutchtest.com. And that concludes our talk. I hope you feel much more versed and understanding in how cortisol plays a role in autoimmunity, how it affects the thymus gland, and makes you understand the importance of testing cortisol with your autoimmune patients moving forward. Thank you so much. Again, I am Dr. Carrie Jones, Medical Director for Precision Analytical, creators of the Dutch test. I appreciate your time.
I want to thank Carrie for this presentation. We're going to go into Q&A now. And just before we do that, I want to remind you guys that on their website, on the IFS website, you can watch this video again. We'll post the Q&A recording here as well. And then there's other talks about, is your progesterone low progesterone, is it a problem with ovulation or the corpus luteum? And then she has a talk on sex drive. And you can also request share the handouts and product information. I'm reminding you that the Dutch group have a special, so check that out. It's in the video too, if you missed that. And Carrie, I wanted to ask you something and just to let everybody else know, my clinic's AcuBalance in Vancouver, and we've been using the Dutch test for a while. I have 2 naturopathic physicians that use it quite a bit. And I'm curious if you've seen this experience with other practitioners. One of the things that we found that really helped us help the women patients we're seeing is that we have some treatments available, but sometimes it's hard to inspire them to follow the treatment. And when we started doing more testing, as we call it, looking for the underlying cause, and they would have a report to see how all these things out of balance, then they started, and we were able to explain why they had certain symptoms and why this could be impacting egg quality. Then they were more motivated to change their diet, change their sleep habits, come for acupuncture, take the supplements, etc. Is that isolated to AcuBalance, or have you found that
Of course not.
Yeah. So is that one of the best? Because that, to me, the test was, it's the patient it helped us narrow our approach. So rather than a shotgun approach, we could be more laser-like. We got more specific, and the patient understood why, and they saw the test, and that motivated them now to follow our program.
No, I would have patients that would put the results on the refrigerator. I mean, some of them were just had been really struggling for a long time. And when they got their results back from whatever company they were getting results from, and I had patients that were like, I knew it wasn't all in my head. I knew there was something going on. I'm going to put this on my refrigerator. This is amazing. And you're right. I think it really helps. The visual helps the motivation, which is great, which is priceless, because that's our goal, is to help them help themselves. And
I'll let my colleagues know. So if you guys are using Dutch tests, I'm curious if you found this has helped with patient compliance. I'm curious if you guys have had that experience. And then at the beginning, every time we would run a Dutch test, they would have a consult with you guys to kind of really learn the test. now we've been using it a lot. We very rarely, unless we get weird results, do we need to talk to you. You guys are still offering that. I think that's what I heard, but because that's important. The support, you guys help with the interpretation?
We do. Yep. For practitioners who have a practitioner account, not all designations, unfortunately, can have a practitioner account, but those who do, acupuncture is fine. Absolutely. We do consults Monday through Friday.
Yeah, it's available to acupuncturists as well. I used to do it at the very beginning, and then my naturopath, you guys love this more than I do, like the naturopathic style, so they took that over, but totally most of my acupuncture colleagues are using this. And then I recall you talked about this one for the saliva. Do you guys have a urine test too? Is that part of you guys, or is it all saliva? Because you talked about the sponge.
It's the combo. The Dutch Plus that I talked about in the video is the combination, the dried urine and the saliva cotton swabs. So you do get all the bonus out of the urine. So all the metabolites, the estrogen metabolites, melatonin, androgens, androgen metabolites, progesterone, what have you, some organic acids. And then we pair it with the saliva cotton swabs because, I mean, let's face it, it can be really tough to spit in a tube. Passive drooling can be long and arduous and gross. And that's why we like the bonus of being able to use the cotton swabs. But we can't get metabolites out of saliva. You can't get estrogen metabolites or, the androgen, 5-alpha DHT and androsterone and etiocalanolone. You don't get those out of saliva. You get those out of urine. So it's the marriage of the best of both kinds of testing.
Because I do know the urine test, our patients are definitely using the urine. And I know in our clinic, we're always concerned about the oxidative stress for the egg. And there's a marker you guys show about oxidative stress that they're always liking to see, and then they show the patient. Okay.
Yep, the 8-OHDG. And that one as well, you can only get in urine, not in saliva, not in blood.
Yeah, and that helps us motivate them with the oxidative therapy we use. A couple questions for you from the audience as well. What types of options are there for mitochondrial support as it relates to CAR and immunity?
Oh my goodness. So honestly, it's a lot of, if you're doing, there's the external stuff. So there's things like red and near infrared light therapy. There's intermittent fasting, exercise, cold exposure. So the people who are into cold showers, cold plunges. Now you have to get the shiver effect. When you are in cold, just being cold is not going to start thermogenesis. You actually have to get it cold so that you are shivering, and you don't have to be shivering in the water. You can get out of the water, air dry off and then enact the shiver effect. But that thermogenesis happens in the mitochondria and in your brown fat. So red and near infrared light, which is different than like saunas. Not all saunas, of course, have red or near infrared light. And then intermittent fasting, of course, exercise, like I said, the cold shiver effect. So that's all like the external stuff. So internally, mitochondria are really susceptible to free radicals. They're really, we need our mitochondria. I love our mitochondria, but good gracious, our mitochondria are high maintenance. And so they're easily damaged. They're easily affected by free radicals. And if the free radical balance wins out over our antioxidant system, that's when we can get in a really big damage. So we now want to support with eating our fruits and vegetables, eat the rainbow. We're looking at our things that support superoxide dismutase. So like our manganese, our zinc, there's catalase, things that support glutathione and acetylcysteine, our CoQ10, our B vitamins. We know that our NAD and FAD are really important in the electron transport chain. One of the markers we look at on Dutch test is called an MMA, which is methylmalonate or methylmalonic acid. And that's a marker of one of the forms of B12. It's not methyl B12, it's adenylyl B12. Adenylyl B12 is what helps you make succinyl-CoA in the Krebs cycle to support mitochondrial function. So if you are deficient in adenylyl B12, then you're could struggle mitochondrial wise. So it's a nice marker on Dutch to look there. Then of course we have our other antioxidants, vitamin E, vitamin C, lipoic acid, flavonoids, green tea. So a lot of these, you do not have to give every single one of these by any stretch, but we have a lot of clients and patients that come to us who don't eat the rainbow. Their favorite vegetable is corn, and they don't get a lot of movement, and they don't ever go outside and get sun exposure. And so And on the flip side, we have very extreme patients who eat a very carefully crafted, colorful diet, and maybe their exposure is affecting their mitochondria. So they have heavy metals, they have mycotoxins and mold, they are using a lot of chemicals. Maybe they're in a field such as a hairdresser or a mechanic or something that is exposing them to a lot of unhealthy chemicals affecting their mitochondria. So the topic of the mitochondria is huge. It's a huge topic. And like I said, they're very high maintenance, but they also respond positively to a lot of free, cheap, and easy things. You don't have to break the bank really to support the mitochondria, which is what I like. So there are a lot of options, everything from diet to what you can do lifestyle to what you can take supplementally.
Carrie, there's just a question. They want a clarification because in this group we have predominantly two groups of licensed acupuncturists, TCM practitioners, and naturopathic physicians. The acupuncturists want to know, can they set up an account directly with Dutch so they can get that support?
Yes. Yeah, yes. Absolutely.
Okay.
Absolutely.
Perfect.
For sure.
If a person is taking the Throxin upon awakening and has blunted or low carb, when do you introduce the adrenal mito support?
I know. So this is where it's challenging because we know thyroid medication, she's a diva and she likes to be the only thing in your stomach for an extended period of time. So we have to work with the thyroid medication. If your client or patient is choosing, it works best for them to wake up in the morning and take their thyroxin or whatever thyroid medication they're taking, then you really do have to wait an hour, sometime, depending on the person, depending what they're taking, 2 hours before you can then introduce any other kind of supplementation. Thyroid medication doesn't play well with like things that have phytates in them, things that have fat, things that could get in the way of absorption. So your option is to wait for the supplements, do the best you can, and use light to your advantage instead. So when they wake up in the morning to take their thyroid, make sure they're doing it in front of a open window, have them do it outside, have them turn on a full spectrum light box that they bought online and keep it on for 10 or so minutes so that they get that full spectrum exposure. The other option would be to, if they were wanting to consider it, I've had patients who were like, you know what, I'm going to start taking my thyroid at night, or I'm going to, and I don't really recommend this, but I have patients who do it. They set their alarm really early and they will get up, take their thyroid and go back to sleep. I think that's disruptful for their sleep, but I definitely have patients who it works really well for them, or maybe their partner gets up early for work. And so they just get up, take their supplement and go back to sleep once their partner is gone. So there are some options for thyroid, but we just have to work around it and do the best we can. There's no perfect when they're taking thyroxin or thyroid medication on waking.
How do you feel about licorice root extract and pregnenolone for treatment of low morning cortisol?
Yeah, absolutely. Licorice helps to keep cortisol as cortisol. It slows the conversion of it to deactivate it from cortisone. It acts on the enzyme 11-beta-HSD2 so that it keeps it as cortisol. Just please be aware with licorice that licorice obviously can affect blood pressure. It can raise blood pressure. It can cause hypokalemia, so loss of potassium, depending on your dose and how long you're using it. So make sure you're following up with them and just be aware of your licorice dose. So 50 milligrams of licorice is different than 600 milligrams of licorice. And our herbal companies definitely make every kind of range in between there. There's licorice solid extract, there are tinctures, there's, it's mixed in with adrenal support at like 25 or 50 milligrams to act as a harmonizer. Other supplement companies are using it as 600 milligrams per capsule or tablet to really knock them over the head. So just keep all that in mind. But you could totally do licorice in the morning if it's warranted. On the Dutch test, we do give you an indication. I didn't show it in the video, but we do give you an indication if that enzyme 11-beta-HSD2 and 1, which way it's leaning. So if you're already leaning towards cortisol, if you're already favoring cortisol, even though your cortisol is lower or blunted, cortisol may not work, licorice may not work as well for you in that case because you're already pressing the accelerator on cortisol. And so licorice may not be your best option there. But if you, on the Dutch test, if you're leaning to deactivation, if you're leaning towards cortisone, which is inactive, that's when we find that licorice works the absolute best. When you are more of a deactivator, then it helps to turn you back around. It doesn't address the cause. You still have to figure out, why is that person deactivating? Is it stress? Is it sleep? Is it burning the candle at both ends? Have they been fighting an infection? So licorice can be a really great Band-Aid, but it's not going to stop. If the person's not going to stop burning the candle at both ends, the licorice is only going to give them a false sense of energy for a while, and they'll burn back out again. So just be careful.
All right, we still have a few more questions. And
Sure.
I just want to remind listeners that if you want the handouts, then please contact Dutch. They're happy to share them. And on their sponsor page on the IFS website, there are 2 other fantastic lectures by Dr. Carrie Jones I think you'd find interesting, and you can request those handouts. And then as part of the IFS, she has a CEU-approved talk that people have been talking about in the forums. It's quite fun, and it's just watch it. You'll like it that you watched it. And she also has a course available on healthy seminars about detoxification, which was really well received, available on demand. So just want to let you know the handouts are available for this sponsored talk, and Carrie has some other CEU approved courses. And again, contact Dutch related. If there's specific questions about my state and stuff like that, contact them directly, because they'll be able to work with you, let you know. You won't be the first person probably from that area that have contacted them, so they'll let you know what they're doing in that area. Can you talk a bit about high cortisol in the morning and kind of a general treatment or supplements you suggest for high cortisol in the morning?
It depends why it's high. Obviously, you guys are going to do your due diligence and finding out, is it high in the morning because you always wake up in a state of like ready, go? And is it work related? Is it because their mornings are always very chaotic? There's animals and there's kids and there's partners, and it's, you know, they go for text messages and emails first thing in the morning. So some of it may be let's say self-induced or lifestyle that you're going to be working with to help them get their cortisol awakening response down. Others may be because, again, in the case I showed of sleep apnea, their car went down in the morning. I have seen other cases though with sleep apnea through the night that cortisol maybe has an over response. They have sort of an HPA axis that's on overdrive, and so that will go up. So now we know that we have to work on their sleep through the night, and that can be quite helpful. Is it more emotionally driven? Is it panic? Is it anxiety? Is it worry? Is it hypervigilance? And so we're going to address that differently than, like, let's say somebody who has a lot of pain. So waking up with a back pain, waking up with knee pain, waking up with migraines, then waking up with infection. Maybe they've parasites that are quite active through the night, and it's causing their HPA axis to go up. And so all of those, as you're doing your detailed history, then you're going to pinpoint into how am I going to address this cortisol? So from a quote, address the cause, somebody with back pain or migraines, you may address differently than somebody who emotionally is very anxious and hypervigilant and stressed out in the morning. But just as broad spectrum supplementation, just broad spectrum calming, we know things such as phosphatidylserine, right? We know things such as holy basil. We know L-theanine. We know, like, vitamin C, very supportive for the HP axis, vitamin B5. We know skullcap. We know passion flower. All of these calming, more generally calming things can be helpful at lowering the cortisol awakening response. Just be careful not to over suppress them in a pain state and make them worse. So if somebody routinely has back pain in the morning and you're trying to suppress their cortisol, and now they tell you that their pain is worse in the morning, then you know that high cortisol was actually trying to be anti-inflammatory and help them. Same goes for if they have parasites or they're fighting some sort of infection, and their cortisol is high in the morning to counter the effect of the infection or the parasites, and you swoop in with a whole lot of theanine and phosphatidylserine and passion flower and all these things, and now the infection gets worse, and the parasites feel like they're taking over. So this is where finding out why is the cortisol high as best you can, and then deciding, am I going to work to bring down the cortisol right now? Or am I going to, like, do I need to backpedal, work on some of these other things, and then come in a couple weeks or a month and then start to lower the cortisol using some of these supplementation? You may also choose to use those supplements at night before bed. So instead of doing phosphatidylserine or theanine or skullcap in the morning, you may choose to do it at night to help mitigate them through the night. So if you know they wake up stressed out, they hate their job, their kids stress them out, they're anxious, they're always feeling like they have to be on, try through the night then. Before bed, I'm going to have you do these calming supplements. We're going to work with breathing exercises. We're going to do 10 minutes of meditation. Whatever fits in their, what they're willing to do, what fits in their budget, what fits in what's doesn't feel overwhelming to them, then you will make those choices. Because some people, you're like, hey, I want you to take Epsom salt baths, only to find out they don't have a bathtub. And you're like, oh, okay. And so that's why I can give you a whole list, but of course you have to fit it to the person in front of you. And that's in the morning supplementation, the same applies. Try to do it within that first 30 minutes, whatever it is. So let's say in the morning, they have a lot of, it's emotional triggers, mental emotional triggers. And so you may say, hey, look, when you wake up in the morning, the first thing I want you to do is 5 minutes of meditation. Right when you wake up, 5 minutes of meditation, that's what you're going to do while you put this, L-theanine under your tongue or whatever it is. Try to get within that first 30 minutes, whether it's low or high. So I know it's very broad spectrum, but I hope it helps.
Here's a question about understanding the testing and the they want to know, like, considering that every day can be different, all our stress, etc. How do you know if taking a test on a given day is generally going to be diagnostic? So
we tell people to try to do it on a typical day because the test is only for that day. No serum, saliva, or urine for the most part is not like a hemoglobin A1C. Meaning, if you do a Dutch test and you're looking at cortisol as an example, it's not a 3-month average of your cortisol. It's only the cortisol or the day that you tested. So we highly advocate that if your Monday through Friday is roughly the same because you are working or you're getting the kids off to school or you're homeschooling your kids or whatever it is, try to do it Monday through Friday. If you're going on holiday or if your Sunday is super lazy and relaxed, then that's what that's going to be you on holiday, or that's going to be you on a lazy, relaxed Sunday. And you will have to keep that in mind. Now, for the other hormones, estrogen, progesterone, for example, in women, that of course is very cycle related. So if she has a menstrual cycle, then you're going to follow her cycle. And ideally you will collect in the mid luteal phase. If she's menopausal, then it doesn't really matter because she's not cycling anymore. So we do have a method to our madness if she's cycling and as far as timing, which is in the instructions. And we do strongly suggest please test on a typical day because if you are a Monday through Friday person, I could say like day person as opposed to like a night shift worker, which is very different. If you're a Monday through Friday day person, then your Monday through Friday, your schedule may be different, but the stress levels are probably the same. And so that's when we recommend trying to do the test. But we absolutely have people that are like, well, I actually want to know what I look like on holiday. I'm like, oh, then okay, then go ahead. Or they'll compare. They're like, I want to see me at my worst. And I want to see me like when I think I'm really relaxed. I'm like, great, go for it.
And it's good to have these tests because I know in our practice, I just did a telehealth session last week and she said, I'm going to send you my hormone test. And she sent me the Dutch test, which was so nice to have that test and all that stuff. So it's helpful. But it's one of almost kind of our common tests that we do for our patients.
Yeah. I just posted my own Dutch results because perks of the job, I get to do my own testing to my social media because even being the medical director of the Dutch test, of a hormone test, definitely not perfect. And it was really interesting, let's use that word, to see my cortisol and to see how I had come through 2020 and how I was handling everything. And so having it on paper, I was like, oh, look at me burning the candle at both ends. There it is in the red.
So
I guess
go
I'll do
check
something
out
about
Dr.
it.
Carrie Jones's Facebook page and check out her hormone
Right, my
levels.
Instagram. Yep,
Yeah.
you can see. Yeah, not
Okay.
perfect.
Another question related to insomnia. If a woman's chief complaint is insomnia with waking between 2 to 3 a.m., which of your tests are you suggesting?
Honestly, you could do either the Dutch Complete or the Dutch Plus because both of them have an insomnia sample. And make sure, because insomnia is her chief complaint, that she does do that collection. You would be surprised the number of people who report insomnia and then like that one night they don't happen to wake up between 2 and 3 a.m. or they completely forget to do the collection and then send it in.
So the collections when you wake up?
So it's, you do it all day like normal. So in the morning, you follow the day pattern, and then we have an extra tube or an extra strip, and you will do that when you wake up in the middle of the night, and we will give you that report. We'll tell you what your cortisol is at that time. So I definitely recommend just and it's labeled in the kit. So say, grab the extra strip or grab the extra tube at 2 or 3 in the morning and make sure you collect that with everything else. And so we can tell you what's up.
And then turnaround time. Once you receive the kits back from your practitioner, how long should they expect until you're able to email them their report?
10 business days, roughly 10 business days once we receive it. So you have to take our lovely mail system into account, which is why when we have a drop ship program, and so when we drop ship kits to patients, so let's say you have an account and you want us to go ahead and ship it up, then we do have shipping. We have returns bags in the kit so that they can make sure we get it back in a timely manner. But if you have the kit at your office and you're, handing them out, or some practitioners have the patient bring it back to the office for whatever reason, then however they choose to mail it back could be a little bit different. So we do recommend using the prepaid kits, because that way we know we'll get it back pretty quickly. Avoid our USPS. Your post to our Canadian Post USPS is very slow, and it takes a while to get the results. So, but once we have it, 10 business days.
Again, a big thank you to Dr. Carrie Jones for this informative lecture. Thank you for Dutch Test for sponsoring this as part of the IFS, and thank you guys for your questions.
Yes, thank you so much, everyone. Definitely appreciate it. And please send us an email. Click on the link for the slides, sales@dutchtest.com. We are happy to send them out so you can learn.
Yeah, get those handouts and take advantage of their offer if you're new.
Definitely.
Recording stopped.
Recording stopped, but we're still here. Thank you guys. And if you want, we'll spend a few more minutes here